We're going to go over the rest of the disc pathology test now. And as a reminder, a lot of people refer to it as radiculopathy, but in truth, radiculopathy is a really general diagnosis and it doesn't actually tell you what the problem is. So just remember that when you're doing this stuff that you actually need to figure out what the actual issue is, what the injury is, and some of these tests are going to help you do that as well. Again, the sensitivity and specificity of these aren't as great as some of the other tests that we've already gone over, in particular the centralization and perforization tests, but these are also really excellent tests to do on patients that maybe have difficulty standing or anything else. And the first one that we're going to do is the straight leg raise test. And this can be used for sciatica, but also for lumbar disc pathology, where you're going to have radiating pain going down your leg. And it's a pretty simple test. All you're going to do is take the side that's affected. So if his right side was affected, then I would take his right leg and just bring it with extended knee into hip flexion. And usually from the first 0 to 35 degrees, you're just taking up the neural slack, so they shouldn't be experiencing any kind of pain. Then from 35 to 70 as you're coming up, that's where you're going to start seeing people complaining of neuropathy. So they're going to say it's either burning, tingling, shooting pain, numbness, something like that, that's going down. And then as you continue up, once you get past 70 degrees, if they start complaining of pain higher up, then really what you're looking at is either SI joint pathology or some kind of vertebral issues within the lumbar spine. And then the next thing that you can do is, if you want to verify that this is an issue, say he complained of pain kind of right about here, then what I could do is lower him down a little bit and then passively dorsiflex his foot, and then that could potentially bring back his symptoms. And if that's the case, then that's a good way to verify that we are looking at a neuropathology and not something that's dealing with like vertebral issues or muscle or something like that. Then the next one is very similar, but it's called the cross straight leg. And really all you're doing is the exact same thing as what you just did for the straight leg SLR test or Lasègues test, but you do it on the opposite side. So again, if he was complaining of pain on his left side now, I would do the straight leg test on the right side. And you don't have to go all the way up to 70 because you're not looking for back pain on this side, lifting this leg up. So again, left side hurts, pick the right side up, shouldn't have any problems for the first 35 degrees, and then as you're extending up from 35 to 70, they would complain of pain on the opposite side, not on the side that you're elevating, but on the opposite side. And all of the same things that I said really apply to this particular test. And then what we have after that is Kernig's test. And again, Kernig's test is pretty similar. The sensitivity and specificity for this is not outstanding. But all you do is passively bring them up into about 90 degrees of hip flexion. And then you're going to slowly extend their knee. And they should be able to get all the way to full knee extension in a passive position like this. But if they can't, and they have reproduction of their symptoms, so again, burning, stinging pain, numbness, tingling, any of that kind of stuff going down, then that's an indication that it is a positive test. And kind of similar to what I said before, where you can go up, and if they start complaining of pain, say he's about here, and he starts saying like he has radiating pain coming down from his lumbar spine, I can flex his knee a little bit more, so take some of that tension off, and then I could dorsiflex his foot to see if that brings the pain or numbness or tingling back. And again, that would be another way to positively assess that they're having some kind of neuropathy or radiculopathy that's coming down. That's most likely coming from a herniated disc. And then the last one that we're going to do is the slump test. So I'm going to have him turn and sit. And this is probably one of the most widely used tests for disc pathology, and it's actually one of my favorites, but it also looks at a bunch of different stuff. So you start out having them sit up really nice and tall, and then you're going to ask them to just flex forward their lumbar spine, so slump their lumbar spine and their thoracic spine, but keep their head upright. Don't let them flex it down. And then once they're in that position, just very light overpressure on their shoulders, and then you ask them to flex their chin or bring their chin to their chest, And if they still don't have pain, then you give them a little bit of overpressure. And if that's still fine and it's not exacerbating their symptoms, you would ask them to actively extend their knee. So bring their knee all the way into full extension while you're still applying pressure. And if that's still good, then you would passively dorsiflex their foot. If this isn't like about killing them, then they do not have any kind of lumbar disc issues, or I at least wouldn't anticipate that they would have any, because that type of test puts their entire neural system from basically their occiput all the way down to their toes on really, really high tension. Okay?